Good morning and good afternoon. It's my pleasure to be your moderator for today's webinar, Targeted Financing for Health Equity, Considerations for Financing Female Genital Schistosomiasis. Today's webinar is organized by GIZ, the German Agency for International Cooperation, and the Ministry of Health and Sanitation in Malawi. And this is together in partnership with the German Ministry for Economic Cooperation and Development, or the BMZ, and FIG, the FGS Integration Group. My name is Alison Krentel, and I'm speaking to you today from Ottawa, Canada, where there's still a little bit of snow on the ground. I'm an associate professor at the School of Epidemiology and Public Health at the University of Ottawa, and the current chair of the Canadian Network for Neglected Tropical Diseases. And we are also a FIG member a FIG member as well. Over the last 5 years, I've also been a researcher involved with the FAST package, a holistic intervention to address FGS in Africa. So I'm delighted to have a front row seat at what is going to be an important and dynamic discussion on FGS financing today. So before we get started, I'd like to introduce a few housekeeping items. Many of you will have been, probably most of you have been part of webinars like this before, but a few notes for this one. There will be translation available in French and Portuguese. In addition, there's captioning for those of you who may need it. And during the session today, please do add your questions through the Q&A button. And if there's a specific speaker you'd like to address your question to, please indicate that in the Q&A. As well as we get started, please introduce yourself in the chat and where you're calling in from today so we can see who's in the audience. So our agenda today will begin with some opening remarks from our esteemed colleagues in both Malawi and Germany. We will then follow with a short video introducing female genital schistosomiasis, or FGS, as we often use the acronym, and then we'll transition into the technical content on FGS financing. We'll then have some time for Q&A and discussion towards the end. So you'll see from the next slide that we have an excellent lineup of speakers today. And they come from across government and technical partners, and they are all committed to addressing the important and neglected area of women's health, that is FGS. So if you can go to the next slide, please, Anouk, we can see the lineup of our speakers today. So as we begin, unfortunately, I must give you the news that Dr. Dan Namarika, the Secretary for Health and Sanitation in Malawi, has been called away at the last moment to an emergency. And so he is unable to deliver his remarks as he's traveling. But we continue to be grateful for his ongoing support to address FGS in Malawi, and I know he will look forward to hearing the outcomes from our event today. And I wonder, we were just seeing if there was going to be a last-minute representative from the Ministry of Health in Malawi who's able to provide a couple of welcome remarks. Pamela, I'll pass over to you. Sorry, Jane, if there's any update there. Otherwise, we'll move on to our next speaker. Okay.
I contacted Paul. I think he'll be able to give the opening remarks, but maybe we can go ahead with another. He will come in later.
Okay, excellent. We will come back to you, Jane. Thank you so much. And so it's my pleasure then to welcome who will be our first speaker to the floor, Mr. Matthias Zeike. He is presently the head of division for pandemic prevention and One Health in the German Federal Ministry for Economic Cooperation and Development, or the BMZ. Mr. Zeike joined BMZ in 2008 and has held several positions during his tenure. He was advisor to the German Council, member with the Global Environment Facility, and part of the German delegation to the Conference of the Parties of the United Nations Framework Convention on Climate Change. and was a senior policy officer for bilateral cooperation with South Africa, among other accolades. So thank you, Mr. Zyka, and the floor is open to you. Thank you.
Thank you, Alison. Good morning, good afternoon, good evening to all colleagues participating in this webinar. Thank you for your interest in this very important topic. And particularly, I would like to thank all the colleagues from the government of Malawi for their strong engagement in this partnership. So I also would like to say a big thank you to the GIZ and the Global Schistosomiasis Alliance. You have been preparing this work for many months in order to give us new insights, and I think we are very much looking forward to that. So starting this webinar, I shortly would like to explain why the BMZ, our former minister, Mrs. Svenja Schulze, has started the FGS initiative 2 years ago at the World Health Summit in 2024. And there are particularly 2 reasons. The first is that female genital schistosomiasis still is widely neglected, although it affects millions of women and girls. And it has serious health consequences, social stigma, and it also influences the whole economies of the societies that are affected by this disease. But it is not only a health issue, it's also an issue of human rights. There is the human right to access universal health care, and especially important in our political environment at the moment, also to advancing gender equality and achieving the Sustainable Development Goals. What is important from our side is that while we want to engage very specifically into the reasons and the right mechanisms to tackle FGS, we strongly believe that this should not be an isolated approach, but it should be integrated into strengthening the health systems in all our partner countries worldwide. So it cannot be tackled in isolation, but we need stronger health systems to tackle this topic. And we also hope that the people in neglected regions where there is not enough diagnosis yet and also not enough treatment, that people speak out and also ask from their governments the needs they need as communities. Of course, we are now in a quite challenging global environment with the shrinking budgets of ODA, and some of the traditionally very strong partners having reduced their global engagement very dramatically. So it's even more important to integrate FGS into the health systems, but nonetheless to partner in this international environment, and we would like to continue our engagement in this spirit of being a reliable partner with our partner countries in Africa and worldwide. So thank you again to our partners in Malawi, and maybe you want to take the floor now or later, we will see, but I'm also very much looking forward to the presentations on financing and the organizational framework of FGS.
Thank you so much, Mr. Zyka, for those remarks and for acknowledging the importance of strong health systems to address FGS. as well as the importance of communities advocating for their own health to their governments. We are very grateful for the commitment and the partnership through BMZ and the GIZ in this area. So thank you so much for kicking us off with some important remarks. And I'll just see now if we were able to secure a representative from the Ministry of Health and Sanitation in Malawi who might be able to just give us a couple of welcome remarks, and recognizing also that this was quite last minute, and so appreciate that as well. Jane, I'll just go over to you for a moment. Otherwise, we'll move into our film.
Good afternoon, everyone. We have our country director who will provide the welcome remarks from this side. Thank you.
Excellent. So it will be my pleasure then to introduce the country director here. Are you online, please?
Yes, I'm online.
Oh, hello, Dr. Baumgarten. Okay, excellent. It's my pleasure then to introduce you who as the country director of GIZ, the German Agency for International Cooperation. She is a social and behavioral scientist and social anthropologist with an MSc in public health with over 25 years of international cooperation experience across sub-Saharan Africa, South Asia, Europe, and other global platforms. Her work focuses on sustainable development with strong practice in multi-stakeholder coordination across governments, civil society, private sector, and regional bodies such as ECOWAS and the African Union. So Dr. Baumgarten, thank you so much for stepping in, and pass over to you to give a couple of welcome remarks. Thank you.
Thank you so much, Alison. It's a pleasure to be connected today and to have the opportunity to participate in this webinar, which is very important. And thank you, Anouk, from the Global Alliance also for organizing this and bringing everybody together on the important issue. Good morning and good afternoon. Bonjour et bonsoir à tout le monde. I'm happy to be connected today, as I said. And I would like to begin by extending my sincere thanks to the Ministry of Health of Malawi. Unfortunately, Dr. Namarika is not present today, but as you know, colleagues connected from the health sector, there's always an urgency and an importance to attend to that. So I think we all understand that this might have been a challenge, but we will think of the Ministry of Health in Malawi even more now that Dr. Namarika is not with us. Thank you so much also, Mr. Seicher from BMZ, for your insightful opening remarks. I think you have powerfully set the stage for today's conversation on a deeply urgent, but yet so often overlooked issue. So from the perspective of GIZ and international cooperation, I would want to highlight why financing for female genital schistosomiasis, FGS, is far more than a technical health intervention. And I think that echoes very much what you already said in your introduction, but I think we can mention it several times because it's so essential also here in Malawi to advancing Malawi's goal to eliminate schistosomiasis. But more than that, as you pointed out, Mr. Seicher, it's a critical lever for achieving health equity, for upholding the rights of women and girls, and empowering communities that have long been marginalized in health systems. So, ladies and gentlemen, it has been mentioned before that without dedicated financing, FGS remains largely invisible, leading to delayed diagnosis, inadequate treatment, and ongoing suffering for many women and girls. So targeted financing is essential to close these gaps and shine a light on this hidden epidemic. And today I look forward to hearing more from our presenters about their recommendations and analysis on FGS financing and integration as we continue this important conversation. Ladies and gentlemen, what I want to emphasize is that investing in FGS control is a direct investment in women's and girls' health. Addressing a disease that disproportionately affects them. It helps close gender gaps in healthcare access and outcomes and advances health equity. Tackling FGS reduces stigma and social exclusion, improving quality of life and community participation for affected women. FGS financing contributes to their empowerment by giving women control over their reproductive health and reducing barriers caused by this disease. And I guess you know more than I do that these are really very difficult situations the women find themselves in. Ultimately, tackling FGS contributes to breaking cycles of poverty and poor health. And here in Malawi, where I am based and where I'm connected from Lilongwe, Malawi's broader health development agenda and the sustainable development goals. So it's interconnected across several of these. So, ladies and gentlemen, what is GIZ currently doing under the FGS initiative in Malawi to support these objectives? I just want to point out a few things to give you concrete examples. With our partners, we are working on different levels. We are supporting policy development, we are supporting the improvement of health service delivery, and we raise community awareness together. Currently, FGS management has been integrated, for example, into cervical cancer screening documents, as well as sexually transmitted disease treatment guidelines, promoting service integration and improved continuity of care for affected women and girls. Moreover, the FGS training package has been developed to enable capacity building of health service providers from targeted primary health facilities in Dedza and Salima districts. So we are making progress. And on community level, the initiative has supported school health programs through schistosomiasis and FGS awareness campaigns, aiming to promote early prevention and knowledge among school-aged children. And until now, more than 15,000 students have been reached. To strengthen sustainability and resource mobilization, an FGS investment roadmap has been developed together with the Ministry of Health and our partners. And about this, we will hear more in a few minutes. So, ladies and gentlemen, as you see, prioritizing FGS financing is not just a health imperative, but a crucial step towards social justice and empowerment for millions of women and girls. Together, through strong partnerships and sustained targeted investment, Malawi can reduce the burden of FGS and unlock greater health and empowerment for its communities. As GIZ, committed by the Ministry of Economic Cooperation and Development in Germany, we are committed to supporting this mission and advancing the sexual and reproductive health and rights of women and girls in the country. So I thank everyone present today, but also here in Malawi and beyond, for your interest and participation in this webinar. I also want to express my appreciation for the long-standing partnership with the Malawian government and for the spirit of exchange this collaboration embodies. One that we hope will inspire further South-South learning across the region and strengthen global partnerships on sexual and reproductive health and rights. Ladies and gentlemen, thank you very much for your attention. And back over to you, Alison.
Thank you so much, and thanks for stepping in and providing your remarks at this time. So you've highlighted so many important pieces that we need to bear in mind. And I really liked your focus on and mention of social justice, which of course we know is such an important aim in the work that we're doing for FGS. So perhaps before we launch into the next set of speakers on the technical content, we'll have a short film just for those of you on the call who might not be as familiar with female genital schistosomiasis. And so we'll start with that film, and this will kind of ground you in the issue. A few of our introductory remarks have highlighted how neglected this health issue is, and it is one of that involves stigma and social exclusion, and one that has not been addressed in many endemic communities, just given the lack of awareness. And so with that, we'll have this short film, and then it'll be my pleasure to introduce our next set of speakers. So over to you, please, Anouk, for the film. Thank you.
There is a neglected condition that affects 56 million women and girls. It is one of the most overlooked sexual and reproductive health issues in sub-Saharan Africa. Female genital schistosomiasis, also known as FGS, causes inflammation, discharge, and bleeding. Left untreated, it can have severe health impacts including ectopic pregnancies, miscarriage, and infertility. Women and girls affected are at risk of cervical cancer, and they are also 3 times more likely to acquire HIV. As the condition is relatively unknown, and because the symptoms are similar to sexually transmitted infections, women and girls are often misdiagnosed. This can expose them to stigma and gender-based violence. FGS is caused by the urogenital form of the parasitic infection schistosomiasis. Schistosomiasis is caused by parasitic worms that live in fresh water, transmitted to humans through snails in freshwater lakes and rivers. People become infected when they come into contact with parasite-infested water. This happens during daily activities such as fishing, washing clothes, swimming, working in fields, or fetching water. Without anti-parasite treatment, FGS develops when parasite eggs become embedded in the reproductive system. FGS can be prevented and treated with the drug praziquantel. Transmission of the disease can be reduced through improved access to safe water and sanitation services. Find out more about the role you can play in tackling FGS and improving the lives of women and girls.
And thank you to FIG for pulling together that video for us. It's excellent and gives us a really nice overview of this issue, FGS, and how neglected it is, and the public health repercussions, of course, as a result. So as our first speakers have highlighted, investment in FGS control is an investment into women's and girls' health. And it contributes to their empowerment and to their future as well. And so we're really now in the kind of meat of our webinar today. And it is my pleasure to now introduce the next set of speakers who are really going to lead us into the issues around financing for FGS. And so it's my pleasure to introduce Mr. Christian France. He is a partner and co-founder of CPC Analytics, and he leads the company's Berlin office. His expertise lies in the analysis of global health policy and economic policy in Germany, Europe, and beyond. He has led more than 30 projects at CPC Analytics, consulting public sector clients as well as NGOs and corporations. He's researched and published on Germany's, the EU's, and India's roles in global health. He'll be presenting today with his team member, Kirill Karlashkin, who is a consultant with CPC Analytics with public sector experience at PwC and EY across Russia, Kazakhstan, and Uzbekistan. And he has co-led the healthcare consulting practice and delivered projects for regional ministries of health and private partners. So we'll pass the floor over to you, and then I will introduce the following CPC speaker in a moment as well. So thank you very much.
Thank you so much, Alison. Welcome, everybody. Thank you, Kirill, for putting up the slides. As Alison said, both of us are consultants in this project from CPC Analytics, a small data and policy analysis company based in Berlin and Pune, India. And in this case, we're working on a topic that has been very close to our hearts for years now. Neglected tropical disease, but also female genital schistosomiasis. We have worked in the past also with the German network against neglected tropical disease. I saw some of the German NGO stakeholders in the attendees chat, a shout out there as well. And today we will cover of this presentation the first section, and Kirill will take over a good chunk of that, and I'll come in at the end. And then we'll move to Tikala, who has run a companion but separate study on FGS on covering the Malawi side. So I hope that we'll answer a lot of questions in the next few minutes. Let's move on. Kirill.
Yeah, thank you, Kristen, and greetings, everyone. We will now present the results of two studies. The first study is dedicated to the global mapping of FGS projects, and the objective of this study was to analyze the landscape of FGS-specific projects, and based on this analysis and the interviews with the experts, propose a set of actions and initiative for global funders to address neglect that exists for FGS and scale up project financing for FGS as well. The global mapping used two approaches, both quantitative and qualitative. First, we collected and mapped the projects, FGS-specific projects, from a set of databases. These included OECD creditor reporting system, development portal, databases of large donors and funders, and we also checked the project reports from several organizations. In parallel, we conducted a set of interviews with experts in FGS, STD, and NTD, and the results of this project of ours was the map of 25 FGS-specific projects and a set of recommendations that also followed this map. Another study that will be delivered by Tikala was dedicated to the financing mechanism for FGS in Malawi. The aim of this project was to develop a strategy to address FGS in Malawi, and Tikala and her team delivered it with the use of a desk review of strategies and national strategies, programs and plans, and a set of interviews with more than 30 stakeholders across different organizations. The output of this study is the National Investment Roadmap for FGS in Malawi, and Tikala will shortly present it as well. Let's start with the global mapping of FGS projects. So during the analysis of the landscape of existing and recently completed FGS-specific projects, we identified 25 projects. And analyzing each of these projects, we systemized, structured funders, specialized intermediates, and implementers of each project. Funders are the organization that provide funds, right, financing for such projects, and they include philanthropic organizations and businesses such as Children's Investment Fund Foundation, Merck, They also include bilateral donors, including the ministries, the dedicated official development agencies, and other foundations, national foundations in different countries. And also multilateral and global organizations were also included in this register, in this map of FGS specific funders. And these, for example, include EU Horizon program that also supports FGS specific projects. Specialized intermediates are the organizations that provide technical expertise, assistance, project management, and financial management services, and they are often dedicated to the problems of schisto of FGS, and they sometimes also act as implementers. Implementers are the organizations, both the global acting both globally and at the national level, that are responsible for the delivery of these projects. And due to the nature of some of these projects, they often include research institutions and universities, dedicated NGOs, and also at national level, ministries of health of endemic countries as well. So this map includes examples of the of funders, specialized intermediaries, and implementers that we identified during the analysis of the landscape. Working on this mapping helped us also to identify and find the challenges that exist with the FGS-specific projects. So mapping helped us to reveal and structure these challenges. The first challenge that we believe is crucial is the limited number of projects, of FGS-specific projects globally. As I mentioned, we used the quantitative approach and checked the largest databases of different projects and development assistance projects, such as OECD and Development Portal. Checking these databases initially gave us more than 200 projects dedicated to schisto in general, but after manually checking and deduplicating the projects, we reached the final number of FGS-specific projects to be 25. So overall, we now have the map of 25 FGS-specific projects, which is much less than we started at the beginning. Another challenge that we also identified during the analysis of these FGS specific projects was the predominance of research-oriented projects. Here you can see the structuring of these projects, and more than a half of these projects are research studies or research studies plus implementation pilots, and only few of such projects reached the scale-up stage. Another problem or challenge that we identified during the work on this FGS map was the overall small number of funders who support FGS projects. Unfortunately, FGS remains to be a neglected disease within the domain of neglected tropical diseases, and fewer than a dozen funders are active in this space. The examples that were also mentioned on the previous slides include Wellcome Trust, Merck, the organizations and development agencies from the United Kingdom, Germany, France, Canada, Japan, and Switzerland, and multilateral institutions such as the Horizon that I also mentioned. Also, due to recent reductions in US global health funding, this might have created a significant gap affecting entities in general, and also it might affect the further support for FGS projects as well. Finally, the fourth challenge that we also identified when analyzing these 25 FGS projects was the fact that the data on financial resources was quite limited. Actually, less than a half of FGS projects have publicly available data on its budget. This often comes due to a number of reasons. The first reason is the multi-funder nature of such projects. FGS projects are supported by different funders, and to come to exact amount of funds dedicated to a particular project is sometimes difficult. Another thing is that FGS projects are often embedded in broader programs, and the information about the budgets of such projects are not detailed enough to identify the actual budget dedicated to FGS specific activities. And the last and maybe minor point is the inconsistent financial reported practices. Sometimes funders do not specify or do not aggregate the data to particular FGS specific projects. All in all, taken together, the map of the projects that we identified and the challenges with the support of the experts that helped us during the interviews led us to the development of a set of recommendations for global funders. And now Christian will continue with the presentation of these recommendations. Thank you.
Thank you, Kirill, also for that nice segue. I really appreciate, and I take it now forward for the next couple of minutes. Let's stay for a moment, Kirill, on this slide. On the left-hand side, you can see what recommendations we put as a first set of activities, as enablers, you could say. And I'll dive into detail in a moment, but then the question is, so what does that mean for our financing ideas, for our financing structure? Let's go to the next slide and dive into these first enablers. So the policy inclusion, and then maybe I need to take a step back and take you back a few years, because those of you who have worked within NTDs have surely seen this kind of trajectory over the past years, that we have tried to push the agenda away from a mere vertical disease-oriented focus to a more horizontal, being embedded in a health system approach focus. I think that is still continuing and has to continue. However, now, at least since the beginning of 2025, we are in a quite different financial situation where the funders ecosystem is quite different. So suddenly we see a lot of programs going for a specialization narrative, I would call it, rather than an integration narrative, which means we see with the squeezing of funds in the international space that there is suddenly a fierce rivalry. And that fierce rivalry is often confronted with, let's specialize more, let's get more of those investment cases, how many people saved per dollar, etc. So these kind of framings are present everywhere, and we have to address that trend, even if we don't appreciate it. And so when we speak about policy inclusion and advocacy here, we have to also think of it as a reframing of FGS, and you've seen this in this webinar as well happening in how the different participants have spoken about FGS. This is a major women's health issue. We are not claiming that we fight an individual disease only. We are starting with the people, we are starting with the whole health of the population at hand. We are starting with women and their health. So I think a very consistent approach stating, hey, this is not about a disease vertical that we are doing here. FGS starts with women's health. And I think this is a visibility aspect that we need to make strong about FGS. And you may be surprised that I am saying this in the context of financing, but I think this is the starting point where the financing starts and where most of the the foundational starting points for how big we think when it comes to the numbers that we need financially for FGS. That is where we have this starting point and where we should start. Then you can imagine with a data and policy analysis company like CPC Analytics, we strongly believe in that data matters for policy. And to matter, that evidence matters for a policy field means it needs to show up in the data. And that kind of FGS data scarcity, however many projects have tried to address this in the past, is still very much a present day problem. And this goes to a next step. If there is no indicator against which an endemic country is measuring progress, then where's also the political incentive to invest in this? I think here is like a double-edged piece, a global piece, and not a double-edged, but a two-sided of the same coin piece. We need the global indicators and we need the goal indicators in the endemic countries. Let's go to the next slides, Kirill. On the left-hand side, you see the resource coordination pieces. So the resources we have seen in our analysis that when we speak about so we have these 25 projects, we have a very limited set of funders and implementing agencies, but also implementers in general. And despite this rather limited field, we still see a fairly a strong fragmentation within the projects, and not necessarily a reutilization or reutilization of materials and of replicable models. And so that is I think a big piece is behind that is we have to understand that while the innovation process starts with the experimentation, we also need a follow-through pipeline across the different steps that allows us to reutilize pieces and proven concepts that we have had. And this is true for diagnostic tools, but that is also true for training materials. And I'm sure we'll hear about a few projects later that have done that quite well. And so then the coordination piece, you could see at the beginning when we heard from Alison also about the FIG, this kind of coordination at the strategic level is super vital. And we have seen this in the projects that we have analyzed. If there is a clear connection to the global but also the regional coordination of these mechanisms, then we get the impression that this money is more effectively, more efficiently used. We will see this integration or this coordination happening while FIG provided that for the female genital schistosomiasis community and towards the NTD community and other communities. We'll see that, I believe, if we want this as a true enabler to move to other sectors too. And you see a bit of a list there on the presentation. And I know that it's quite difficult. We have tried this for the past 10 years, at least, in the NTD community. But I think with the FGS, with the current FGS point of view, I think it offers a lot of opportunities to be that kind of magnet topic. And lastly, let me go a bit into detail on the financing piece. As you can read here, using existing or developing financing models that explicitly support FGS integration from pilots to scale-up programs. So that's what I meant earlier with the whole pipeline already embedded. So we have to accept that the flexible financing models that we need to use to design, to pilot, and validate proof of concept interventions, that they need to be connected they need to get the feedback and then to move towards that scaling piece. Because these 25 projects, if they were 100 times the size that they are, then I think we could really speak about making a stab at fighting this kind of public health problem. If they stay at the scale that we have now, I hardly think this is appropriate to the scale of the problem. And the last piece is on the develop financing models that integrate FGS across sexual and reproductive health and rights, across NTD programs. And I think we can also go maybe later into, before I speak too long, into a few examples where this has happened successfully in different countries. But I want to leave it maybe here now, for now, and hand it back to Kirill or to Alison. I'm not quite sure now what is the next step, but I thank you very much for the attention given, and see you later in the discussion.
Thank you so much, Christian. I will just briefly interject here to introduce our next speaker, who will continue with the example from Malawi and build upon what you have introduced here. And I'll just hold my comments and takeaways until after our next speaker. So it's a pleasure for me to introduce Ms. Tikala Itaye, who is a human rights lawyer and public health specialist with over a decade of experience shaping health policy and advocacy agendas at national, regional, and global levels. She's worked with many organizations, including Frontline AIDS, Gavi, the Vaccine Alliance, Women in Global Health, and the Gates Foundation, where she has led strategic initiatives on gender equality, universal health coverage, and health system strengthening. So it's a pleasure to pass the microphone over to you to continue the presentation with the case study from Malawi. So over to you. Thank you.
Thank you, Alison. So looking at the findings in the case study of Malawi, and Kirill and Christian, I think you laid down a great foundation to similar findings and a country perspective, which I'm happy to share. Looking at Malawi specifically, we know that approximately 20% of women and girls are affected by FGS. During the analysis of FGS in Malawi, it was discovered that there are ongoing FGS projects, which also align with some of those that Kirill shared. The ones that were identified during this analysis were as a cross-sectional study, which is led by World Health Organization, WHO, in one of the districts that's looking at the estimating prevalence and associated factors of FGS. Also, the Malawi German initiative, which was shared upon in detail earlier on during the opening remarks. Particularly, I looked at piloting FGS integration into primary healthcare, one of the pilot initiatives that is ongoing at the moment with the Ministry of Health. And also, there is the Schistosomiasis survey that is happening in Malawi, which is nationwide, estimating prevalence of schistosoma, hematobium. And also existing studies that are happening, being led mainly by the Malawi Liverpool Trust, is the HUGS study, which is the hybridization in urogenital schistosomiasis. And this is happening in about 3 districts, particularly studying FGS system patterns, health-seeking pathways, and extent of misdiagnosis. And also another large study that's happening in Malawi is the MORBID study, which is looking at morbidity operational research for bilharzia implementation decisions. And this is exploring health consequences of FGS among women and girls. This is just to kind of give you a landscape on what is happening around FGS currently and the research that's ongoing. This has been looked at as the entry point for FGS integration within Malawi, but there is a gap within most of the existing research that's there, is that most of the research hasn't truly captured the lived experiences and the gendered consequences of FGS, which is still an ongoing gap. Next slide, please. So in the analysis, one of the key things that we also identified was around the barriers hindering FGS integration. And it's great to see some of the stakeholders that were interviewed during this analysis among different government institutions, Ministry of Health and Ministry of Agriculture, Ministry of Finance. Some of them I can see are on this webinar, which is great because a lot of the findings were informed by them. But some of the structure barriers that were informed and shared were around the limitation in clinical training. So it was identified that FGS does not appear in pre-service curricula for nurses and midwives. And this speaks to the pilot initiative that is happening with GIZ Malawi and Ministry of Health to address this. District health facilities also lack basic examination tools, resulting in lower provider confidence and misdiagnosis. It was also identified that there is inconsistent commodity availability, and women of reproductive age are mainly excluded from praziquantel mass drug administration. Malawi does have a national control schistosomiasis program that's looking at MDA, but what you are seeing that is a challenge is that MDA is happening among children aged between 5 to 14 years old. So you could already see that women of reproductive health that are affected of FGS are excluded from MDA for praziquantel. And lastly, there is limited FGS inclusion in national frameworks. Currently, which has been a great milestone for Malawi through advocacy initiatives that was led by a civil society organization about 2-3 years ago. Pakachere had led some advocacy initiatives that led into the integration of FGS in national NTI guidelines. And with discussions with the National AIDS Commission, there's also been integration of FGS within the National HIV and AIDS Strategic Plan. So you are seeing a bit of progress in the integration of FGS in key national policy frameworks. Looking more at the challenges related to financing specifically on FGS, Malawi does not have dedicated budget lines for FGS in national or district budgets. Discussions within the Ministry of Health, the Planning and Budgeting Department, mainly shared around budgeting around schistosomiasis as a whole, but not specifically on FGS. And this could probably speak to data gaps around FGS. Financing also right now is embedded in short-term research grants and donor projects. What was also noted that there is a limited transition from pilot projects that are ongoing around FGS to government-led programming. So just the issue of uptake with among donor-funded projects that are currently happening and that have been happening in the past. So there is heavy reliance on donor funding right now related to FGS, and this is also because of just the limited health financing domestically. I think most of you can relate with the different funding cuts happening globally and also challenges within government health ministries with shrinking funding. There is challenges on sustainable financing in the health sector alone, so which also would speak into the issue of unpredictable financing for FGS. It was also noted that there are opportunities around reproductive, maternal, newborn, and child health to integrate FGS, but has been under prioritized to look at that as an entry point within existing programs and for budgeting, but also looking at also broader health system programming and whether it's within the essential health package, routine healthcare, where there are opportunities of integrating FGS. Next slide, please. So based on the analysis and the barriers shared, the stakeholders that were engaged and interviewed through this process went through a process of identifying recommendations around investing in FGS, and some of the key recommendations are the ones that I will present here now. The recommendations are set out and aligned with the WHO health system building blocks, which looks at the following. Firstly, health service delivery. And the recommendation around here was around integrating FGS prevention, screening, and treatment into primary healthcare. sexual reproductive health, HIV, and cervical cancer programs. A need to standardize clinical protocols and strengthen referral systems and service readiness. This was noticed as high priority recommendation to ensure women and girls can access quality FGS services through existing health structures. This would speak mainly to the challenges around misdiagnosis and the lack of equipment within health facility, and this was why this was also strongly added here as a high priority. Secondly, looking at evidence, and I think, Christian, you touched on this strongly around data. You know, without data, it's very difficult to budget and plan for within policy frameworks or health strategic plans. And this was strongly noted by representatives from Ministry of Finance and other key development agencies that shared about just the data gaps and the lack of awareness on FGS. So it was recommended that there is a need to conduct a national prevalence survey in FGS to just truly understand the impact of FGS and how to really financially budget for FGS as a country. A need to integrate FGS indicators into the health information system. I think this was already mentioned earlier on by Christian, the importance of indicators within data health systems. A need to implement FGS awareness and advocacy campaigns across sectors. And I think just sharing earlier of the example of a civil society organization, Pakachere, that led advocacy initiative that led to FGS being integrated in the national STI guidelines. And this was also seen as a high priority and to ensure that there is greater national visibility to justify FGS financing. The third thing that was looked at was around access to treatment and technology. And I touched on this earlier on as well on the health service delivery, but one of the key strategic focus on this was around ensuring consistent availability of praziquantel for women and girls above 14 years. A need to integrate diagnostic into health benefit package, and to also strengthen supply chain accountability. This was noted just based on experiences that are happening on the ground, and that there is praziquantel being supplied and supported by Merck in the country through WHO and working together with the Ministry of Health, but a need to kind of understand just the supply chain challenges, any praziquantel that's left from MDAs, how can that be transferred and used in health facilities? So pretty much looking at those kind of processes around supply chain for praziquantel. This was noted as a medium and ongoing priority. Rationale behind this and expected result was to expand treatment coverage and service readiness, as well as to complement MDA campaigns and with routine adult access. Next slide, please. And the other key three investment areas was around leadership and One Health coordination. There is a need to strengthen interdepartmental coordination. In Malawi, there are existing technical working groups already within government ministries. And there is one technical working group for One Health, and the others around sexual reproductive health, water and sanitation. And most of these technical working groups would be made up of stakeholders either from civil society organization, government stakeholders representing the different respective areas for in multi-stakeholder coordination. With discussions with different ministries, Ministry of Health, Ministry of Agriculture, and Ministry of Water and Sanitation then, which are now Ministry of Health and Sanitation in Malawi, there was an agreement that the interdepartmental coordination as well as interministerial coordinations are entry points to prioritize issues of FGS. Specifically on interdepartmental coordination within the Ministry of Health, you are seeing collaboration between the NTD department with the Department of Reproductive Health Directorate, as well as health promotion. So there is that coordination happening where there is opportunity for entry points for FGS being embedded within the interdepartment coordination. Another key thing is the One Health coordination, and I'm sure most countries within sub-Saharan Africa are looking at the One Health, One Plan program, and Malawi has been pushing this as well, and there's been efforts around this. So there is an opportunity to institutionalize FGS within One Health. Already, schistosomiasis is already recognized within that under animal and environmental health issues. So there is an opportunity to integrate FGS there. And need to also coordinate with WASH and environmental health interventions. As mentioned earlier, a lot of discussions we had with Ministry of Agriculture or Minister of Water and Sanitation then were actually not aware of FGS, even though a lot of the work that they're doing is treating water and issues of waterborne diseases, but we're not aware of FGS. So a need to really strengthen coordination with WASH and environmental health interventions. So this was also seen as a medium-high priority recommendation to promote multi-sectoral coordination and joint resource mobilization. The other key recommendation was around health workforce capacity. And this also looked at the need to incorporate comprehensive FGS modules into pre-service and in-service training, and need to deliver practical and competency-based sessions using diagnostic tools, but also need to credit continuous professional development, CPD modules. This was also seen as a high priority and need to reduce misdiagnosis that's currently happening, and in order to improve detection, treatment, and referral rates across all levels of care. And lastly, it was around health financing, right? I think the biggest thing is how do we get FGS funded and financed? And one of the strongest recommendations was the need to develop a costed national investment case that is, of course, informed by data. A need to also introduce FGS budget tag within the ministry planning and budgeting system, and also to leverage on existing joint working groups and partnerships within the country. So Malawi currently has a health service joint fund, and this is supported by Germany, Norway, and the United Kingdom, which pretty much work together and pool resources to support the health sector in Malawi. So how to leverage into these joint funds to bring in issues of FGS and also within the One Health pool mechanisms. And lastly, a need to engage private sector. Discussions with the Business Health Coalition in Malawi, they really strongly shared that there's a need to get data to understand how FGS affects the labor productivity of women. And they felt like that data would be crucial to really get private sector on board to also invest in issues of FGS if we can see a connection with labor productivity. So some of these key recommendations on health financing was to ensure sustainability. And to close off on the case study for Malawi, one of the key things we worked on was to develop an investment roadmap, which I will probably be shared in this webinar. And the investment roadmap captures these key recommendations and the 3 foundational priorities, which is around strengthening data and evidence generation, increasing awareness and recognition of FGS, and also ensuring inclusion within national and sectoral policies and plans. And I will end there for now and bring it back to you, Alison, for any kind of questions and comments. Thanks.
Thank you so much, Tikela. That was excellent and really great to see the specifics of this being brought into Malawi. So we've got some time for discussion, and there's been some questions that have been put into the Q&A. So please use this opportunity now to add some additional questions that you might have. And I would also encourage our speakers to have a look at that as well, and we'll try and address some of those as well directly into the Q&A function. So some of the key takeaways from our speakers, just as we bring them back on again and highlight them in preparation of the discussion. Despite the high number of affected women and girls with FGS, there's a limited number of projects on FGS specifically, and you indicated 25, with the predominance being research rather than implementation and scale up. So a real need to have a pipeline to scale up innovations and to include more donors into this space. I really also appreciated this comment about the value of integration, but yet funders are now striving to specialize their investments, and how can we think about that as well? And then really hearing about the Malawian example and just the amazing milestones really that have been accomplished by integrating FGS within national STI guidelines and the National HIV and AIDS Strategic Plan, which I think are so important and provide real leadership for other countries looking to follow suit. And yet you highlighted some other really important areas that need to further facilitate financing and integration of FGS into the National Health Service and service delivery. So I'll invite our speakers to come back on again, and please bring your camera forward, turn your camera on. And we'll start with a question for Tikala. With so many recommended actions, where should Malawi start to make FGS visible and integrated within routine health services? So over to you.
Thanks, Alison. And such a good question, right? Because there is a long list of recommendations. Sometimes trying to figure out where to start is so difficult. But I think from perspectives from the different stakeholders that we had interviewed, and also from the Ministry of Health themselves, they really strongly shared that the data is critical. They do feel like with the ongoing research that is happening, I think there's a need to kind of consolidate all the research that's going on and really truly understand the prevalence of FGS, and that could be a starting place, right? And stakeholders like Ministry of Health, other development organizations, donors can actually use that data that can inform planning and the budgeting, right? And I think beyond the issue of FGS awareness, right? Even to understand where is the gap in FGS awareness requires that data to understand that. So I think the biggest thing would be really getting that data that will inform policy and budgeting across all levels.
Yeah, thank you. And I think, I appreciate it also. I want to just give a moment to give space to your comment about DHIS also in the integration of FGS indicators. And we know that takes a lot of time to get those kinds of indicators into the system. And so just being aware also that that's a really important step so that ministries have that data available. Christian and Kirill, over to you all for this next question. How can flexible financing models be applied to FGS integration projects or similar initiatives? So what are some advantages? And perhaps you could provide us an example of what a flexible financing model might look like.
Maybe I start and Kirill can take the second piece. Thanks so much, Alison. So I think the flexible piece needs to accept that there are some pieces in how we deal with FGS in a given country that are not yet clear. There are behavioral health system specific pieces that need to be acknowledged. And Tikala showed the Malawi case, and that's why it's so valuable to have these two different perspectives, I think, simultaneous, because it really grounded the global perspective that we had in the analysis in some real world discussion. But we have to accept that some elements are still in a piloting phase. So when I say flexible, can we think of models that are tiered stage gate financing? So what I mean with that is we have already an idea at the outset, okay, there is like a pilot phase, but if we make it to a particular success rate, to a particular success in general, then we have already the follow-up funding thought about. And so there are examples out there. One is, I give a bit of the story in a moment, the USAID Development Innovation Ventures, DIV. I'm sure many of you have heard of that, a pretty big program in the past, and it got slashed, as you can imagine. However, this one has a second life. And so just recently, two funders, one of them has remained unknown, have given a couple of dozens of millions of euros to resurrect this kind of fund. But what it does, it takes a venture approach, and it says from the start, here are your gates. You pass through one gate, the next tranche is done. You have the research to back it up, next tranche is done. And so the scaling is implicit in the whole idea. The key idea behind all this is somehow FGS appears to be trapped in a limited funding pool available to it. On the one hand side, it doesn't access the same money from the true NTD vertical Schisto program. At the same time, at the other end, it has a hard time getting the health system funding because also it doesn't show up in the indicators in countries. So it is a bit stuck. So we need to find a way to get out of that. Otherwise, a topic like FGS, I think, will have a hard time. But sorry, I'm speaking a long time. Maybe over to Kirill to answer the second part of the question with an example.
Yeah, I will add the example that is related to FGS. One of the projects that we analyzed during the research was the Dual Safe FGS, which is EU Horizon sponsored project. And the key idea is to develop a new technical tool that allows to diagnose FGS, and this project is also a stage gate project, a flexible project, actually split into two components. The first one is the research, R&D, technical development of this tool, and the second part is the clinical trials in the endemic countries. And this particular case allows us to check that such projects might be, as Christian mentioned, structured across like 2 or 3 or several stages. And one of them might be the R&D, proof of concept, and then the clinical trials. And the money dedicated to the second stage is dependent on the results or the outcomes of the development and the trial phase. So this is the example from the FGS space. Thank you.
Thank you so much. And I think I think the reframing of FGS as a critical women's health issue, Christian, that you highlighted in your remarks, I think is really important to make sure that FGS doesn't fall through the cracks that it's currently falling through. We have a question from one of our attendees. How can financing mechanisms better support community awareness and demand generation for FGS services, given the stigma and low awareness? And I wonder, Tikala, if you would be able to answer that one.
Yeah, it's a very tricky one, right? Because it kind of goes back to the same issue of data, right? Do we have data to understand where is the gap in awareness? I think that's a critical question as well. I think even my experience of interviewing 33 stakeholders and only about 10% knew FGS. And I think with that realization that only 10% of people knew FGS, it prompted us to actually see the issue of the awareness gap around FGS. So I think, to answer your question, it really boils down to really understand where are the gaps around FGS, especially among community and women and girls that are affected. They need to actually also understand what is FGS. How do they understand what symptoms they have, right? There is that level and awareness needed at community level, but also there is the issue of also health providers, right? Trying to understand how they diagnose and identify FGS within the clinical level. So I think investment in either side still requires data, right, to inform that programming. But I think beyond the data gaps, there are existing initiatives that are happening in the country, recognizing that FGS is not well known at community level and health service level. I don't know if there are any stakeholders in the group on the webinar here, but BICO is one key organization that's been doing a lot of awareness programs on FGS in Malawi. But yeah, I think mostly, again, donor-funded projects supporting this, not yet something that's embedded within national health-funded government projects.
Yeah, and you certainly have highlighted some of the experiences that we saw also in the FAST package, that you can do community awareness, but if your health system and your health providers aren't aware of FGS, then you're creating awareness in an environment where the health service and providers can't respond. And so there's a need for both to be included. There's a couple of questions that I'm going to kind of pull together. And I think, Takala, it's probably coming back to you here as well. But, Malawi successfully integrated FGS into some of its key policy documents around STIs and HIV and AIDS. And I wonder if you could share some of the lessons learned from that process, like who needed to be brought on board and what kind of, any insight you could give us that might be helpful for other listeners on the webinar who are considering a similar direction.
Yeah, I think advocacy. I think a lot of people who are working in the civil society organization have seen how advocacy is needed to raise urgency of a particular health issue. And I think the example I was sharing earlier, how in Malawi, a civil society organization, Pakacheri, had led some advocacy initiatives. I mean, it all started with holding a meeting with key stakeholders like Ministry of Health, the National AIDS Commission, mainly within those working in the health sector, and the Ministry of Health were present. A discussion and awareness on the issue of FGS in Malawi, which obviously prompted Ministry of Health to look into how can FGS be embedded, and looking at the close connection of STI and HIV and FGS. Of course, civil society organizations did what they do best in developing a strong advocacy case on embedding FGS into the national STI guideline. And I think through that consistent advocacy and push within the Ministry of Health, they had a successful outcome. Of course, this is a very unique situation, and I think every country context is different, but I think one takeaway could be just the continuous engagement and advocacy and awareness by civil society organization to embed FGS within existing policies and strategies in the health sector. And I think secondly, also to mention that advocacy needs to be funded. I think one of the things I've also seen in the past, issues like FGS and any other entities, it's not a 6-month, 12-month advocacy funded project. It needs to be ongoing, right, to you actually achieve the expected outcome. So I think just, a recommendation to development partners and donors that are funding civil society organizations doing advocacy, that it's an ongoing engagement. And it can't be like a 6-month or fixed period to ensure that some sort of result comes out.
Yeah, thank you for highlighting that very important point. Advocacy takes a long time. It's a long game, and we have to continue at all levels, at national levels and regional levels and at global levels. So I really appreciate that. The next questions I'll pass over to Christian. And just in your, when we think about financing, are there concrete mechanisms, and this question comes from one of our listeners, what concrete mechanisms can countries use to make FGS visible within their national budgeting processes? And wondering if in any of the projects that you reviewed or or your experience from other areas, if you could give us any advice or findings that you have on what countries could do to make FGS more visible within their national budgeting processes. Thank you.
Thank you, Alison. So actually, I want to I have to say a disclaimer here, because our analysis started with a global perspective. If I now sit here from a global perspective and make big judgments about what countries are supposed to do, that's a very thin ice sitting in Berlin here. So please take what I'm saying with this grain of salt, that I'm making them with this global analysis point of view. Maybe the question in the chat is a good about the global fund is a good hook to answer this. So could we, at the moment, convince the global fund to put money into interventions at a country level against FGS? And I think we would have a very hard time to make a strong case with the global fund, not because there is a weak case for FGS, just because there is a very strong competition case in the global fund. Everyone who knows how it is to deal with the global fund also knows how difficult it was to even get a health system perspective in there. So coming with FGS as one piece to address, I think we'll have a very hard time at this massive funding organization like the Global Fund. Similarly, I think on the country level, if we think that at this time we can lobby only for one disease, FGS, for one syndrome, for one narrow piece alone to get domestic funding, I don't think that is the approach that we will succeed in at the levels and the time frame Tikala mentioned. It doesn't help if we have 6 months, 9 months, right? We want a larger time frame. So I don't think this is the way to go. And maybe to tie in one last thing into this, because I saw a question in the chat on aren't diagnostics an important first step? Yes, so I agree, but then we end up with a chicken and egg problem, because one person says diagnostics is the starting point. The next person says, yes, but to make sure that we really put enough effort and funds behind that, then where does this data then go of the diagnosed cases? Do we have the right indicators at the country level to embed this? So I feel formulating the agenda of FGS with these kind of bottleneck. Let's first get the cross-country burden study ready and then move on. Let's first get the diagnostics and then move on. I personally think this kind of piecemeal step is logical, but is not where we need to go. Like, we can't let us be narrowed down always by these stop points. Over.
Thank you for that. And I think it brings us back to the real lived experience that women and girls are facing, and the need to make sure that we are providing services. for them. So I'm just going to give Tikala the last question, and I'm going to ask you to respond relatively quickly if you can, because we're reaching the end of our time. But we had a few remarks about the shrinking public and donor funding landscape. And so what would motivate private sector actors to invest in FGS as part of health and development efforts? So I'll give you the last word on that question.
Thanks, Alison. I'll try to answer this in 1 minute. I think, firstly, there's a need to understand the lived experiences of women working, right? A lot of private sectors are going to invest in the employees of their organizations, institutions, companies. And they need to understand how FGS is affecting labor productivities of women within their workspaces. I think that is the biggest data gap, and with that data can inform and attract private sector financing. So again, the need to capture those lived experiences of women in the working sector at different levels. And then I think lastly is also to say that Malawi does have a domestic health financing strategy that is actually looking at pulling domestic resources from different sectors, including private sector. And I think just kind of sharing this, because I think other countries could also learn from that, because I think with the shrinking funding cuts, there is now a push at country level to understand how can they do more to pull in domestic resources towards addressing the financing gap in the health sector.
Excellent. Thank you very much. And if we were in a big hall or a stage, we would join in a round of applause, thanking you all for your slides today, and also for answering these questions as part of the discussion. I know there's many questions we didn't get to, and so I thank everybody for your engagement also in the Q&A. We will wrap those questions into a meeting report from this webinar, and so we'll do our best to respond to those there. So it's my turn to wrap up and thank everyone. I would also like to thank not only our technical speakers, but also our speakers from BMZ and GIZ, Dr. Baumgarten and Dr. Zeike for launching us today into this important webinar. And I would also like to just acknowledge Dr. Dan Namarika from the Ministry of Health and Sanitation in Malawi, who at the very last minute was unable to join us. And we just remain grateful to their partnership on FGS in Malawi. And it's wonderful to hear today on what has been done and what is being done in Malawi to ensure that FGS is integrated into health systems and health service delivery. So I think our speakers today have given us some real practical tips and next steps to consider for FGS financing. We're in a current context that presents multiple challenges, as we've heard, to financing our global health and development goals. But among those challenges, there are opportunities for new financing mechanisms through domestic resource mobilization, private sector funding, and bilateral partnerships. And we also highlighted, of course, the importance of advocacy at different levels to ensure that FGS is prioritized as a critical women's health issue and to ensure that it doesn't fall through the cracks anymore. The next steps in terms of this event, the recording will be made available, and we'll do our best, as I said, to answer some of those unanswered questions that you put forward to our speakers today. Please also visit the FIG website, the FGS Integration Group, and look for more information there about resources for FGS integration and also events like this that continue throughout the year. So I want to thank you once again for your excellent participation, for your interest in this really important area of women's health in Africa. Thank you again to our partners for organizing the webinar, and to our speakers, and of course to our interpreters who have supported us behind the scenes as well today. So thank you, and I wish you all an excellent remainder of your day.
Thank you so much. Bye-bye.
Thank
Thank
you.
you. Goodbye.